Hi, I'm Dr. Mike Carberry, President and founder of Advanced Medical Integration. It is a company we created to help other doctors to medically integrate, and then it kind of bled over into helping doctors just grow their practice because we were very good at growing our practices. We had multiple practices in multiple states, states we never even lived in, and all of them were very, very successful, all doing well over $1 million, some up to $5 million a year. And so people say, well, he's all concerned about the money. Well, no, actually, the reason I was successful was because my belief in the science of chiropractic, which is what I want to talk to you about today. Before I do that, I just want to thank ChiroSecure for the opportunity to be able to come to you and share with you some of my background and some of my knowledge in the science of chiropractic. Okay, so let's go to the slides. Here we go. The science of chiropractic. Now, I'm a person who found myself in very unique situations in my career, being exposed to different sides of healthcare. So I'm going to share that with you today because my viewpoint, when people hear it, a lot of times they go, "I didn't realize that." So let's take a look at this. So when you look at health, and you look at a disease, a lack of ease, or a problem in the body, you have to understand that there's a timeline. And I drew this timeline to educate medical people who were working with me because I found they were thinking in terms of, well, we got to stop the symptom. We got to stop the symptom. That's how they're trained. So I said, no, we're not going to do it. Here's what we're doing. Diseases, when they start, you usually don't know that you have it, and you go all the way through the process of that disease, and you're probably more than halfway through the disease before you really even have it, because the thing that allows you to realize you have a disease is having a symptom, which usually occurs in the last 15 to 20% of the disease. It's the last thing to show up and the first thing to go away. So if we're managing symptoms, we're going to end up with a really sick country, which we do have. So what do? Well, you got to start approaching why did those symptoms show up? So let's take a look at that. First of all, our healthcare system is based on symptom management. 97% of all drugs ever invented were invented for symptom management, not for curing a situation. I know that because I have family members that are vice presidents of different pharmaceutical companies, and I get to have Christmas dinner with these people, and we have some pretty interesting conversations. So let's take a look at the cost of focusing everything on pharmaceutical. The world's healthcare bill is $9 trillion. That's a lot of money. That is like way more than a billion and way more than a million. So the U.S. portion of that bill is 5.2 trillion, more than half. And that's interesting because we only make up a small fraction, 4.2% of the world's population. So a small percentage of the world is spending the vast majority of the healthcare bill, and what do we get for that? Well, we get lots of prescriptions because that's the driver for all that money. So lots and lots of prescriptions. Doctors are trained to think in terms of symptom management, and you have a symptom, they'll give you a medication for that. This is how Americans end up on 18 to 20 medications per day if we were to divide it all up equally, which is ridiculous. So 96+% of all drugs ever invented are for symptom management, and most are inhibitory in nature, meaning they stop processes. So you got to remember, we're doctors. What are we working on? What's the thing we work on? If we're mechanics, we're working on cars, but we're doctors. We are not human beings having a spiritual experience. We are spiritual beings having a human experience. That was a Catholic priest named Pierre Teilhard de Chardin, and I love that quote because it is very, very accurate. What drives this body is the spiritual being. So when you look at the body, you go, well, what does the body actually need? So the input that goes to your body is sensing the environment. Now, I do teach neurology in a lot of states, so we're going to tap into that right now. You have to sense the internal environment inside your body and the external environment. And if I were to ask you, which do you think your body does more? Most people say the internal environment because it's got to monitor a whole lot of things. Well, that's not true. The number one source of information is perception of the external environment. It is 90% because of fight or flight. Your body, the brain has a quest. The sole purpose of the brain is to perceive the environment and create a response that will promote survival and reproduction, which is species survival. So the quest of the brain is to survive. So what it's doing, the decisions it makes is based on the information coming into the brain. So my wife, her background was a traumatic injury and traumatic brain injury and stroke rehabilitation. And this is a picture of her. She did her affiliations at Henry Ford Hospital. She graduated from Marquette University in 1984. She became the supervisor of every PT department of every hospital she ever worked in. And her job was to wake people up out of a coma. Well, when she first heard I got injured and I was taking medication. I stopped doing that, and I decided to go to a chiropractor. She was very concerned. She went with me to find out what was happening, and when she saw the chiropractors working on me, she went, "Oh my gosh, these guys are tapping into the keyboard to the brain." And I didn't know what she was talking about, but she said, "Listen, when we wake people up out of a coma, we strap their body into a tilt table, which you can see in the picture right here. The tilt table, they strap their head in or put a collar around their neck. They strap onto the table, which has a platform, and they elevate it so they become weight bearing while they're unconscious. Well, what does that do? Well, it activates systems in the body. And this happens to be the tilt table we saw at Naples Hospital when my mother-in-law had an injury, and we went there. I said, "Oh, look, there's her tilt table for brain injury." So there's an example of it with somebody with a collar keeping their head up so their head doesn't flop forward. They are loading these people into a weight-bearing position with those big straps so that they activate the proprioceptive nerve endings in the body. Proprioceptive nerve endings are bodies or nerve endings all over your body that sense awareness of your environment. Why is it doing that? It's your escape, your panic button. If you walk out of your office and there happens to be in Florida an alligator in your parking lot, or you're in Colorado and there's a mountain lion in your parking lot, what you do in the next 3 seconds is going to determine whether you make it to lunch or whether you become lunch. So your fight or flight kicks in, and your body is constantly monitoring that. So it knows I am on uneven terrain. I have to navigate this a different way than if I was in a parking lot or running upstairs. So your body is constantly looking, your brain is constantly monitoring all this. Where are these proprioceptors? The vast majority of them are in your weight bearing joints. Where are your weight bearing joints? Well, 90% of them are between sacrum and occiput. And when my wife looked at it, she's like, "Oh my God, these guys are actually programming the brain because when you stimulate proprioceptive nerve endings, that's what causes a thing called synaptogenesis or new pathways in the brain." So if you have stuck vertebrae, you are decreasing your proprioception to the brain. My wife instantly recognizes, and to this day, that was almost 40 years ago, to this day, she is still a hardcore chiropractic advocate. So joint receptors are the number one place where they are, and that's what stimulates the brain. And 90% of this information is coming from this. If you look, where are the joints that have the most proprioception? Well, surprise, surprise, chiropractors. Number one is C1, and number two is the SI joints. Very, very important joints in our treatment. And when you are mobilizing these joints, you are stimulating proprioception that allows the brain to enhance its ability to function. That's why studies like this come out, which was published in June of 2022 from uh, the British Journal of Sports Medicine. And basically, what they're saying is if you cannot perform a one legged stance for 10 seconds and you're middle aged, you're doubling your risk of death because that pathway is being interfered with. Now, I have this picture here with the eyes closed. They were doing this study with eyes open, which is why I just drew them in there. So you go look at this and you start testing this on your patients, you're going to realize most people, like over 90%, can't do this test. Why is that? It's because their proprioceptive input to the brain has been compromised. And who addresses that? Well, you do. And not many other professions do that. So you look at this, the biomechanics of the pelvis, if C1 or the sacrum is altered, first of all, I'll argue if C1's altered, the sacrum will also alter. That's going to cause a lot of nasty things. That sacrum not moving properly is going to cause decreased imbibition to the L5S1 disc and also the L4 L5 disc. And you see that picture all the way to the right, there's a lot of degeneration. That's why that area is degenerating more than the areas above it. It's not an aging process, it's an altered aging process. And you look at all the muscles attached there that are affected by that. If you're doing rehab and doing upper cross, lower cross syndrome, you're addressing the piriformis and the glute med, which allow those joints to function normally. When you adjust that patient, you are instigating movement in those joints. If you don't do this and you have a PI ilium, like you see in that x-ray in the middle, those muscles get tight and jam the SI joints. So they stop proprioception, they stop imbibition, and that is two major, huge compromises to your health. So what you want to do is you want to keep that pelvis level by having all those muscles function correctly and the joints functioning correctly as well. In an integrated practice, there's some things we can do like a joint injection or an SI injection with even just saline solution to help lubricate that joint. When we started doing this with lidocaine, which is 99% saline solution, the medical doctor did the injection on a stuck SI joint. The chiropractor went to adjust. it moved a lot easier. And the patient got tremendous results. And guess what? We got paid for the SI injection more than we did for the adjustment. So when you combine these things, you are actually enhancing the function of the patient. This isn't about just prescribing drugs. We don't use steroids in our office. We don't prescribe any pain meds in our office. What we do is we'll do injections with things like Tramil, Serapin, lidocaine, and then we're even regenerative medicine sometimes we'll use. So when you do this, you're enhancing the body's ability to function, which helps proprioception, the number one sensory input to the brain, which helps the brain to function and make more organized synaptic connections, making your brain function better, which is why a child should be doing these things as they're growing up. I grew up with four daughters, they're all grown now, but I'd come home to them jumping on the furniture and bouncing off the couch onto a Bosu and, hey, dad, look at this. And I realized the reason my wife was doing that is she wanted to program their brains. So when you adjust a patient, you are increasing the input to the brain. My wife said it was like putting keys back on the keyboard of a computer that were missing because now you have more input to the brain and a better functioning body and a better ability to have immune response. When this is corrected, you enhance getting out of fight or flight and going back into parasympathetic mode. How do I know that? Well, there's lots of studies, lots of medical studies. Here's one of them that says, you see the red at the bottom, spinal manipulative therapy can be seen to provoke an increase in parasympathetic control. Here's another study. At the bottom, it says a single pre-exercise spinal manipulative therapy session induced an acute shift towards parasympathetic dominance. And then here's another one. As a result of review, osteopathic manipulation, they can't do it on chiropractic, but seems to be a valid and effective instrument for the treatment of series of pathologies such as chronic low back pain, fibromyalgia, spinal cord lesions, myofascial graft point, which is scar tissue from surgery, which is actually a condition, migraine, GI tract dysfunction, and depression. So you're making direct input, direct effects on the brain in a positive way when you're doing your adjustments. Here's a study from the University of Chicago Medical Center, Rush Medical Center, published this in 2007. And this is amazing that most of us don't know about this, but they did a study on hypertension and they were trying to compare hypertension drugs and combinations of them to see what was the best way to control high blood pressure. And they used as a placebo a chiropractic adjustment to C1. And guess what won? A single adjustment of the C1 effectively lowered blood pressure equal to two hypertension drugs combined given simultaneously for up to 8 weeks. We should all be hanging these studies up in our office and making sure patients know about it because, and if you work with medical providers, let them know that because it's their studies and it's validating what we do. Here's another one that says forward head posture is now being used as a biomarker to predict longevity because of its effect on the vagus nerve. You shift your head forward, like you see in the x-ray on the left. It's not only causing a hump on the back and possible future distortion of the thoracic vertebrae, but it's actually putting pressure around um, the vagus nerve that's coming out adjacent to the foramen magnet. And so if you put that curve back in there, you're not only relieving tension on the spinal cord, but you're opening up the space, as you can see, where these nerves exit the skull, some of these nerves that are very, very important for being able to go into fight or get out of fight or flight and be in parasympathetic mode. So then finally, I just want you to realize that the body is electric. It's based on the input and output from the brain, and that input is based on biomechanical function and it's your body's advancement with gravity or overcoming gravity. And so what you do actually makes more scientific sense than any symptom management drug ever invented. So the last thing I'm going to end with is if you're doing exercises, remember that when you exercises in a sagittal plane, which is where how most people do it, they go to the gym, they bench press, and they lift their biceps and their triceps. That goes into automatic response and it doesn't have a great impact on your brain. It does on your muscles and it does help your health. But when you start having patients do exercises in a coronal plane, every time you do that, you create a new pathway and it is enhanced stimulation to the brain. There's theories now say it's a great way to prevent Alzheimer's. It's a great way to keep your body so in tune that it can manage the internal environment better because of what you're doing in the external environment. And you don't need really hard exercises. You can see here I have something very simple like sliding jacks or doing bird dog exercises just to engage those lateral multifidi muscles, because that's what's stimulating the brain to say, I have to make a new pathway because this is something I'm not used to doing. Keep that in mind. Keep in mind, doing chiropractic, even by itself, is phenomenal, better than anything the patient's going to get from the pharmacy. Doing chiropractic with rehab is even better. And when you enhance it with certain medical treatments, you have an unbelievable combination that can get people well because you're addressing function, not symptoms. Um, Last thing I'm going to end with is there was a neurologist who was claiming, and he was having great success in helping kids with attention deficit disorder. And what he had him doing was he had him standing on wobble boards having a catch. And that action, because it engaged right arm, left arm, and keeping balance, was enough to drive the brain to get him out of attention deficit without drugs. You have so much potential to help your patients. You need to understand the science of chiropractic. Thank you so much for listening. I want to thank ChiroSecure for allowing me to have the opportunity to bring this information to you. If you want more information from it, you can contact us at our website there. There's a phone number for us, and then our YouTube channel, Advanced Medical Integration. I'm sure a lot of you have seen that. Thank you again for your time, and thanks again to ChiroSecure.